Surgicare Arts, and all the World Institutes as usual. And apparently we're calling this segment Cosmetic Consult with Dr. Angelina. I want to talk about breast reduction, and it's part of our Mommy Makeover special month. And so last time we talked about tummy tuck. This time we're going to talk about breast reduction and some of the breast procedures. So as usual, I got a list of questions. So, question number one. What is the difference between breast lift and versus breast reduction? Well, name speaks for itself. Reduction is when somebody has excessively large breast. The official name is macromastia. That causes problems. And we want to reduce it, so we're actually cutting out part of the breast tissue, some of the breast fat that increases the size of the breast, and so on. Breast lift is more cosmetic, where we actually pull up the nipple to where it used to be or where it wants to be, looking forward, not down, and reduce some of the skin that surrounds the breast. So it's really a matter of how much we take off. That's what makes a difference. Is breast lift included in breast reduction? Yes, in a way, because when we do breast reduction, we do move the nipple up, we make it more perkier and smaller, and so in a way it is included. What is the surgical process for breast reduction? Well, there's a whole consultation process first, which we'll get into in a minute, and then surgical process. It's a surgery. It's under general anesthesia. It takes about a couple of hours, 2-3 hours, just depends how big the breast is, how much work we have to do. What does the anatomy looks like, what type of reduction we chose to do. There are different ways of doing it. And then procedure is relatively painless. We do put numbing medicine in it while you're asleep, so even while you're asleep we numb it up. When you wake up you might feel discomfort, but it's not really a pain that you would feel like, for example, with tummy tuck. Relatively easy recovery. I usually tell my patients to take a weekend off from work, maybe a long weekend. Most people have become pretty functional pretty fast, and very few require any pain medicine other than over-the-counter stuff. Who's the ideal candidate for breast reduction? So, wide variety of candidates. I've had patients who are as young as 17, 18 years old, young girls who developed very quickly, had very large breasts, and it causes trouble. Troubles from social issues, in school, feeling not confident enough, shy about the size of the breast, young girls who want to do sports, and with such a large breast it becomes very difficult. Obviously pain, neck pain, shoulder pain, back pain, all plays a big role in choosing the right candidate. Now, you don't have to be young for this. Obviously, we have patients who are much older who get breast reduction, who either had breast that was large all their life. Some people get large breasts after breastfeeding the kid, and then the breast never reduces. For some people, it's weight gain. And then, same thing, breast increased in size, never lost the size. Now they're large and saggy and cause all kind of problems. Chafing might cause some fungal infections underneath the breast, sweating, all of that stuff adds on. Also, large breasts can cause pain in the shoulders just from wearing a bra, and it causes like indentations in the shoulders just from having that heavy weight being carried around by you all the time. So that is kind of the overview of that. Does insurance cover this procedure? For some people, you have to be qualified for it. There are several qualifications you have to meet. So I usually have you talk to your primary care doctor first, which most people already do by the time they get to me. They already been to the doctors, they complained of all the pains, the back and neck pain and shoulder pain and rashes, and had all kind of prescription creams for that. And finally they said it's enough. We need to do something else. That's when they get to me. I have to do measurements and different kind of sizings before insurance can potentially approve it. What else? Can you get implants same time as a lift? So you don't really need implants when we're doing reduction because we're trying to make them smaller. But when somebody's doing a breast lift, which is a similar procedure in a way as far as the scarring and everything like that, but let's say you had larger breasts, now they sagged because of the age, weight loss, breastfeeding, all that stuff, and we want to have more of that upper pole fullness, yes, we can combine breast lift with implant. How long does the procedure take? I already addressed that. That takes about a couple of hours, sometimes 2-3 hours. I would obviously plan to be here longer because you come in before surgery, usually an hour or so before surgery to get ready for it, get your IV in, meet the nurses, meet anesthesiologist and all that stuff. And of course there's a recovery time after procedure where you have to wake up from anesthesia and kind of be comfortable to go home. Do you lose nipple sensation? Not always. Now some people may lose some of the sensation initially and kind of feel numb around the area, especially where the skin flaps are, for a while. But any nerves, once they kind of get bruised or disturbed in a way, it takes at least 6 months to get sensation back. So a lot of people do get sensation back, but of course it's not guaranteed. How bad is the scarring? Depends how bad you scar. It's personalized to you. Meaning, if you have previous scars and you know you get keloids or you form thick scars, obviously you have a higher chance of getting a thicker scar. If you are normally, don't get bad scars, then most likely you'll heal well. So that's something you have to discuss with the doctor and show the scars if you're concerned about it. But we do all that we can to prevent thick scarring, and we have other modalities for after surgery where we try to help to minimize scarring. Can we go swimming after the procedure and when? So I usually generally say 6 weeks. Some people can go probably after 4 weeks, but I have to look at you, make sure everything healed up on before I will allow you to go swimming too soon. We definitely do not want to submerge all those incisions in the water too early, especially if there's even small openings in incision if it happens. We don't want to get it contaminated, and definitely does not help with healing. The pre-op and post-op. So pre-op, usually we start with a consult, you meet me, we do measurements as I said, we answer all the questions, show you the facility, we review history. I want to make sure I had a breast mammogram if it applies to you. Not everybody will need it, but a lot of people will. Kind of get all of that out of the way, make sure your health is appropriate to get general anesthesia. So that's like standard general surgery or general anesthesia preoperative workup. At the pre-op time, about 2 weeks prior to the procedure, you will get all the consent signed and pictures taken if we didn't take them yet for your insurance, and kind of go through all that process, answer all the questions, get blood work if we need to, get EKGs if we have to. So all of that is done a couple weeks prior to procedure. And then post-op, usually see me several times. You will see me on post-operative day 1, then usually within a week again, and a couple weeks later, and then 3 more weeks later, so we get to see and get to know each other quite well. Is there a non-surgical alternative to breast lift or breast reduction? Not really. For breast lift, I guess if there was a very mild doses, so they're a little sagging, maybe we could do some other things that less surgical or minimally invasive. But for true breast reduction, it's just reduction. I had some people come and ask about liposuction, but it really doesn't work because your skin is still too big for the breast if we take the fat out. So it's better to just do a surgical reduction that way. Of course, we do have people lose some weight if they are severely overweight. That helps to reduce sometimes breast size, but in some people, even if they lose weight, the breast stays the same, and so we still need to help. How can I make an appointment? You call us, you email us, you Instagram us, you Facebook us, you come in and walk in. It's pretty simple. We do take walk-ins if needed. There is a YouTube channel that you can watch, and this video will be on YouTube as well. Subscribe there, and you can post your questions and comments, and we will answer the questions that way as well. And then our phone number is 678-304-0628.